In this video, you'll get a quick overview of Vibrant Healthspan Assessment Panel. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. The Healthspan Assessment Panel evaluates key markers of cardiovascular, endocrine, metabolic, immune, hepatic, and renal health and function. It also assesses markers of inflammation, autoimmunity, and nutritional status. Healthcare providers commonly order this panel for a baseline view of client health. This combination of markers provides insights into various aspects of health, detects potential imbalances or abnormalities, and guides further diagnostic and treatment decisions. It's particularly useful in preventative medicine, managing chronic conditions, and investigating complex health issues. Vibrant's Healthspan Assessment Panel is a serum blood test collected via venipuncture. Fasting is not required. However, providers may ask patients to fast. There are no dietary or medication restrictions. However, providers may ask patients to discontinue medications or dietary supplements prior to collecting blood samples. Vibrant uses the Cobas Pro, Sysmex XN1000, Alcor ISED, molecular devices, SpectraMax, Waters Mass Spectrometry, and QuantSys QView Imager Pro analyzers, as well as all the methodologies pictured on this slide to measure analytes on the Healthspan Assessment Panel. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. Let's start with a quick overview. The Healthspan Assessment Panel sample report is 10 pages long and includes a cover page and then lists all markers. Note, as is the case for all Vibrant America tests, there are no interpretive comments for Vibrant's Healthspan Assessment Panel. The cover page identifies the sample type and includes the results interpretation key. The full report includes the following panels: anemia, nutrition, rheumatoid arthritis, an ANA-IFA panel, the cardiac health panel, glycemic control, insulin resistance, beta cell function, as well as a comprehensive metabolic and renal panel, thyroid, hormones, CBC with differential and platelets, the rest of the CBC here, finally reticulocytes, and other markers, including total IgG, total IgM, uric acid, total CK, human IGF-1, GGT, and LDH. The results are reported as both a number and plotted graphically, so you can visually see how high or low your patient's results are. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's Tack Rules. Rule number 1. If you're sitting on a tack, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 tacks, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there is more than one root cause contributing to your symptoms. In addition to the Healthspan Assessment Panel, consider the CardiaX to examine genetic predispositions to various heart conditions and metabolic responses to associated medications. Also, the Methylation Panel to investigate genetic predispositions which could affect methylation pathways. Also, the Micronutrient Panel to optimize nutrient and antioxidant status, or the NutriPro to optimize both nutrient and antioxidant status levels while also investigating genetic predisposition towards nutritional deficiencies. Also consider the Gut Zoomer to investigate digestive insufficiency and malabsorption contributing to micronutrient deficiencies or insufficiencies, as well as dysbiosis patterns such as LPS bacterial overgrowth or low Akkermansia muciniphila, as well as other drivers of inflammation. On that same note, consider the Wheat Zoomer to investigate wheat or gluten sensitivity and intestinal hyperpermeability contributing to inflammation. And finally, other food zoomers or the food sensitivity test to investigate intact peptide and protein sensitivities, respectively, contributing to inflammation. In summary, Vibrant's Healthspan Assessment Panel evaluates key markers of cardiovascular, endocrine, immune, metabolic, hepatic, and renal health and function alongside markers of inflammation, autoimmunity, and nutritional status. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks so much for watching, and I hope you have a vibrant day.